research focuses on a couple different areas. I'm really passionate about how we can make healthcare safer for patients. And in particular, a lot of my work focuses on making medication care safer. In particular, I focus on blood thinners, or what we call anticoagulants. These are medicines that we use to try and prevent a blood clot, maybe in a patient who has a heart condition that sets them up for a blood clot and a stroke, or maybe a patient who's even developed a blood clot in their legs or their lungs. How do we make sure that they don't get another blood clot in the future? These are really effective medicines, but they're also potentially very dangerous if they're not used safely and in the right patient. So we spend a lot of time working with nurses, pharmacists, and physicians to make sure that the right patient gets the right medicine at the right time. There's a whole bunch of data that we have in the electronic medical record. We are building some interesting dashboards and population health tools that will allow us to search across an entire health system's record, identify all patients who are taking a particular medicine, in this case it'll be a blood thinner, an anticoagulant, and then figure out whether that blood thinner is prescribed appropriately, or might there be a problem with the prescription? Maybe the dose is wrong, or maybe they're on a drug that's not quite right for them. So it'll allow them to be far more efficient in the work that they're doing, but it'll also help them reach out to other patients that previously weren't being referred into the anticoagulation clinic. So we think this can really help our patients and our healthcare delivery. I also spend a lot of time thinking about how we design our healthcare system so that it's as efficient and as safe and as effective as possible. How do we use our nurses, our pharmacists? How do we line up the whole healthcare team so that way it's really efficient? Our work really tries to take knowledge that other people have already developed and integrate that into the healthcare system. So for instance, we have over 3,000 anticoagulation clinics across the country. These are expert nurses and expert pharmacists who help to manage patients on blood thinners. Could we use those nurses and pharmacists to make sure that patients are getting the most up-to-date evidence-based care? Some of the work I do is particularly policy relevant, especially the work that I do trying to make sure that our nurses and pharmacists are able to work at the top of their training. Sometimes there are different regulations that limit what they can do. How can we make sure that the policies at the state and national level empower them to be able to provide the best, safest care possible for a patient?